Good Friday morning, everyone. It is February 18th. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook, Twitter, and on the Medical News Network. Okay, so everyone, today with the Chiefs season over and Super Bowl behind us, it is time to play ball. We are all looking forward to that, even though the players are still locked out. The Royals are preparing for spring training. Dr. Vincent Key, orthopedic surgeon and head team physician for the KC Royals and president of the medical advisory board for the MLB. He is joining us to talk about preps for the upcoming season and the impact COVID will have. Plus, Dr. Doug Burton, he is the interim chair of Orthopedics. He's here with us in the studio. And also Dr. Brian Vopot, orthopedic surgeon and team physician for the Kansas City Chiefs. He is here to talk about athletes in general and also returning to play after COVID and injuries. And we will take a look at all the benefits that youth players get from all of this expertise and also some of those weekend warrior athletes. In news around the Kansas City community this morning, the Johnson County Board of Commissioners has voted to rescind its mask mandate for students K through 6. COVID vaccines available for kids 5 and up played a big part in that decision. About 43% of Johnson County kids K through 6 have already received at least one shot. The county currently has a 12% positivity rate. And of course, many of us are hitting the roads again after about 8 inches of snow that fell across the metro. Here is a live look from one of the KC Scout cams. This is I-69 highway at the Broadway Bridge. They're looking live right there. The roads are still snowy in some areas. Traffic pretty slow this morning coming in. I was on I-35. It's still kind of a mess. Many streets haven't even been touched yet with the snow plows. So if you do not have to get out, don't do it just yet. Also, area blood supply continues to be low, and yesterday, of course, did not help much because snow days mean fewer people are able to get out and donate blood. So the Community Blood Center needs our help. On your screen right there, you'll find a QR code, which will link you directly to the Blood Center's website to schedule a time that you can donate. You can use that, just hover your phone, the camera over that, and then click on the link. It's pretty easy. We'll bring up that QR code later on in the show if you missed it. But you can also call 1-877-468-6844. Also, be sure to get your questions sent in to us this morning on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. All right, let's turn to our COVID count this morning. And Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control. Good Friday morning to you. How's it going?
Hi, it's good.
Hi.
Numbers are staying stable. 58 active infections, 13 in the ICU, 5 on the ventilator, 74 in that recovery period. So 132 total. But again, the overall active infections have really been stable this past week. Some of this, does do with new admissions that come in with the disease, but also deaths. Unfortunately, we did have 1 death in the last 24 hours. Overall, that takes our total to 35 total COVID deaths for the month of February so far this year.
All right. Do we have any reporter questions on the line this morning? I don't think we do. All right, we'll get to our community questions. They're always good ones here in just a few minutes. But let's turn to our topic and also our guests. Joining us is Dr. Vince Key, Dr. Doug Burton, and Dr. Brian Vopot. Good morning, gentlemen. How are you all today?
Great. How are you doing?
I'm good. Good to see you guys. Lots to talk about, but we're going to start with Dr. Burton. Good morning to you. Nice to have you on the show.
Thanks for having me. It's good to be here.
You are a spine expert, spine surgeon. I want to talk a little bit about that, but give us a perspective a little bit of when you have a pro in one of your clinic rooms versus when you're treating all of us regular folks or maybe young athletes.
Well, it's all about what the expectations are, and that's the big difference, right? The expectations for performance and function for a professional athlete are a little different than your weekend softball player, and so you've got to tailor your advice and based upon what the expectation for recovery is.
Yeah, that makes sense. High expectations for certain people, I would imagine.
Absolutely.
And those high-level athletes. So I just have to ask you, when we have doctors and specialists come on here, we always want to know, how has COVID impacted how you've treated patients?
Well, it hasn't really impacted how I've treated them other than the fact that I see a lot more telemedicine than I did pre-COVID. Sure. What it's impacted, though, is their access to care. We look back a year and a half ago, 2 years ago when this started, and we kind of shut down, and that kind of put us a little bit behind the 8 ball in terms of, how many patients we could see, and that backed patients up. And then as we've had these surges, and it's had some impact on the ability of patients to get into clinic because maybe they're sick with COVID. It's certainly impacted our clinics as we've had a lot of employees sick, particularly in January. So just the access to care, I think, has been limited somewhat. We've worked hard to keep it as open as possible, but there's been some slowdowns.
So we've all got a spine, something we can all relate to. What kind of spine issues from the lowest level up to the highest level do you treat?
Well, I mean, the most common thing that we see is the lumbar strain, probably the second most common reason people go to the doctor after the common cold. So that's the most common thing, but then you get into complex issues like tumors of the spine, fractures, and then some of the advanced degenerative conditions.
And this can happen to anyone, or do you have to be a pretty active, heavily active person?
Ironically, the less active you are, probably the more prone you are to back pain. And so
that makes sense.
It's finding that happy medium between just enough and not too much.
All right, we're going to bring in our sports guys here this morning. Dr. Brian Vopot, you work with the Chiefs. How are you this morning?
I'm doing good. How are you doing?
Hey, good. I know the year certainly didn't end up the way we all had hoped, but we still want to talk with you about what it's like to work with that level of player. Let's just give us a little insight, if you would.
I agree with Dr. Burton. It's like treating most people. The difference is you have to figure out what their goal is and what their expectations are. Like, what do they have it coming up? What does the timeline look like? When is their contract? What are they looking to play for? You want to see what the player's goal is, and that's what you kind of have to try to maximize. You want to do what's best for them as a person, not necessarily just the injury. I think we do that with all of our patients. It's just you have to just take a little bit different look because they have different goals than our average patient. So I would say it's fairly similar. It's just you have to just realize what their goal is, just like everyone else that we're trying to take care of.
Well, everyone wants good spine health, but yeah, when your job relies on it, it makes a big difference. For the last couple of years, we know COVID has impacted everyone in some way or another. How has it affected the ability to train? Because training is key to staying healthy and on the field.
I think the teams have done a great job of allowing them still to train. They've had to use some out resources, but they've been able to bring people in by testing and luckily, they have the financial means to make sure that they're testing people to make sure everyone's safe. So I don't think training has had as much of an influence just because of the facilities that they have and the resources they have access to. I think it's been a little bit harder for our average person as well as some of our high schools and stuff recently just because they don't quite have the resources. So I think it's important for them just to make sure we're getting them back into shape before we go directly into sports.
So take us behind the curtain, I guess, a little bit with it. So for these, training is key, especially the off season. But what does it look like? What does a training regimen look like for a pro athlete at that level? And how are they staying healthy? How are their bodies staying healthy during the off season? Or is it just year-round type of training?
It's usually some time off, honestly. When they first start off, the season is a long grind, so a lot of them take some time off for up to like a month, and then before they start training again. And I think it's the type of training. You have different types where you're either trying to build muscle or you're working on strengthening, and then you start progressing that into speed work and into getting ready for the season and getting into shape for the season. It's impossible to stay in top shape for the entire year. That's why you have to have a little bit of downtime to let your body reset. And I think that's a big thing in sports right now we're looking into is looking at how we need to reset our bodies to improve. And I think that's something we need to do with our youth athletes. And and I think we can take that from the pros and look into youth athletes because we're having issues in today's society with our youth athletes overtraining.
Well, that's interesting. I don't think a lot of people know that. When you say overtraining, just overdoing it?
Yeah, overdoing it, yes, sports year round, maybe the same sport. I know Vince and I are on the same page about this. We're doing too much sometimes with our young athletes. Sometimes they need some time off or try different sports. There's something called sports sampling, which it's important, I think, for them to play multiple sports instead of just one single sport, because that's when we see these overuse injuries that we shouldn't be having in young kids.
So you touched on it a little bit, but how do you translate what you gain with the pro experience versus over into the growing bodies of our young athletes? How do you translate the highest of athlete to those who are aspiring to be that?
I think you have immediate information with your highest athletes. And so you see exactly what's happening in real time with imaging, with what's happening with physical therapy. So you can take that and you can translate it to our younger athletes. We have a close relationship with our physical therapists. So we use what we learn in the highest levels. I know Vince does as we all do this. And then we meet with our physical therapists, and we're able to allow them to train the same way to recover. Obviously, they don't have the same time and the same resources, but we can set up some of the same programs as well too, and what they can expect too.
All right, from football to baseball. Royals fans, today is your day. Single game tickets actually go on sale at 10 a.m. this morning. All of this despite the looming possibility that the season might be delayed. As we know, the players are locked out right now, so spring training may not begin on time in Surprise, Arizona, as it does this time of year, but that isn't stopping the team from prepping for what could be a shortened practice season. So this is some video our crew shot last year at training as the team took part in their daily drills. Dr. Vince Key, good morning to you. I'm sorry that you're delayed. I know you said you'd rather be in Arizona right now than in Overland Park. We get it.
Yes, 100%.
What? Yeah, you're going to have to stick it out.
Otherwise, see this hat? I have to wear this hat now. Okay?
It's a good look for you. We like it.
Arizona where it's 80.
It's like hair. It's hair, Dr. Key.
Yeah, it's my Rasta. It's my Rasta hat.
I love it. I love it. All right. You'll be there hopefully soon enough. So what role has COVID played this year in getting ready for the season? We know other things are coming into play, but what about COVID as we get ready to train in Arizona?
It's going to look a little bit different this year in terms of we're kind of taking a text out of the NFL in terms of some of the things that the NFL was doing towards the end of the season. And we'll incorporate some of those things into getting these guys ready. The intake, I think the intake is going to be the most important part. We'll see how it goes during training camp and into the season. So it's going to be a little bit different in terms of what we do in terms of testing of these athletes and the criteria that we're going to use in terms of testing. I also think if a player does develop COVID, that their timeline in terms of return to play will be a little bit different. Some of their screening that they have to do prior to getting back on the field will probably be a little bit of the same, but the timeline will probably be shortened.
A question we get a lot, Dr. Key, is are players required to be vaccinated? Update us on that.
Okay, so they're not required. They're obviously strongly encouraged. I know we have a pretty high vaccination rate. From our kids in the Dominican all the way up to our major league guys. But there's obviously different things that unvaccinated players are going to have to be subjugated to that the vaccinated players aren't. The testing will be a little bit more. And so, I think for the most part, we've given the information that we've given to all of our players. They have to make the decision. But based on their decision, there's going to be things that they may or may not be subjugated to.
So what are some of the common injuries that happen during training? What's most common that you're looking out for or trying to avoid?
Well, obviously, my shoulder and elbow stuff is probably the biggest thing. Guys coming in, if they're ramping up too quickly, sometimes they'll get some elbow discomfort, some shoulder discomfort. The other thing we'll see every once in a while are hamstring injuries. Since we've implemented our program, what's called a Nordic program, into our workouts, we've seen a significant decrease in our hamstring injuries. But it's really the shoulder and the elbow issues that usually will crop up early in spring training.
All right, I want to get to a few questions that we have coming in from our community. So let's get to some community questions, and then we'll go scoot along with some other questions that I have as well. Question this morning from Jean is, are there any easy recommended stretches for us regular people? Dr. Vopat, when we get out of bed in the morning, is there anything, I'm going to go around the room here and just ask, what's your best advice for people when it comes to stretching? How important is it? And if you had to do one good stretch every day, what would it be?
I would say not when you get out of bed. Is more just get your joints moving. If you're going to be stretching, do it after your workouts instead of before your workouts. I think that was a misconception we've seen in the past. You don't want to stretch when you're cold. You want to do it after you've been warm. So I think just kind of getting all of your joints moving first thing in the morning when you're out of bed, just moving things around is the best thing you can do. Then you should be stretching after your workout.
Dr. Key, your advice?
I agree with Brian there. As it relates to baseball, because baseball players routinely don't stretch. They stretch when it's time to do the activity. So you have to warm up your body first, then stretch. My pitchers, they need to stretch on their shoulder every single day. It's called a sleeper stretch or a cross body stretch. I tell people all the time, stretching is every day, strengthening is every other day or 2 days in between. So it's important, especially for my pitchers, they have to stretch every single day, not just when they're going to practice or going to throw a side or a bullpen.
All right, Dr. Burton, how do we take care of our spine every day? How do we stretch out our spine to get some good spine health going?
Yeah, I think that one of the things that you can do is a stretch where you lay on your back and you pull one knee up to your chest and then the other, and then both knees at the same time. That's probably the best stretch you could do for your low back, and you'll really feel it pull in those paraspinal muscles. I agree. You want to be warmed up, but this one it's not quite like stretching your hamstring. So
for a baseball game.
For a baseball game, that's exactly right.
So us regular folks, just getting up and walking to the coffee pot. That might be all the warming up I'm going to be doing for the morning.
Right.
So that's just how it's going to go.
Yep.
Jill wants to know, Dr. Key, you mentioned this. Just why aren't vaccinations required for players?
That's something that was negotiated through Major League Baseball, whether it be that in the Players Association. So they didn't mandate it. And if you really look at COVID, we were really the first of the major sports impacted by COVID because of where it fell going into our spring training and our regular season. So they haven't mandated it. The players, some of them decided not to get it. I think part of it was education. We really needed to educate our players, which I took a lot of time educating our players, myself and Dr. Joe Nolan, and having Zoom meetings with the minor leaguers and some of the major league guys. And so, but again, Major League Baseball did not mandate it.
Dr. Vopot, on the football side, pro football, just what are your thoughts? What's the mood when it comes to vaccination in the NFL?
I think it's the same thing as been said. It's just the discussion with the players and with the teams, and when they didn't mandate it, but the majority of the NFL did get it, just because of there's extra steps they had to go through if they weren't vaccinated. So the majority of the players are.
All right, Dr. Hawkinson, you're up. All right, Dean has a question. I have seen posts on Twitter that claim that vaccinated and boosted are more likely to get Omicron. Now, he assumes this is garbage, he says, but wants to know what Dr. Hawkinson thinks.
Yeah, I mean, again, I think there is gray in there. We do know and understand that Omicron can evade our antibody defenses, our antibody immune response. I wouldn't say that they are more likely to get Omicron than the unvaccinated, if that's what we're talking about. We know that those vaccinated people, however, especially within that time frame of maybe 2 to 3 months after that booster or that third dose, you also are building up some antibodies to Omicron as well. And so, that statement is not completely false. We know that is what has led to some of the global displacement of Delta to Omicron as far as cases go. But I think it's important to understand that cases don't tell the whole story. And really what we're looking for is to help protect you against symptomatic disease and severe disease and disease that leads you to the hospital. And those people that were vaccinated, even with Omicron, have less chance of going to the hospital, less chance of going to the ICU. So there is a lot of details in there. We have to understand exactly what we mean. Do we mean just a case where if we swabbed your nose, we would pick it up on PCR? Or are you actually ill enough to go to the hospital? And those that are vaccinated are still going to be less likely to go to the hospital. But we do know that Omicron evades our typical antibodies very well. And again, that is what has led it to surge across the globe. So again, I think we have to go down and get granular and get into the details of really what that statement means. Hopefully that helps.
Dr. Key, Isaac wants to know, how are the players getting ready if they don't know when the lockout will end?
Well, they're getting ready. I mean, they're doing their normal regimens in terms of their off-season workouts. And so the question's going to be, once they're like, my pitchers are throwing sides and bullpens, they're just not at the complex. So guys are still getting ready to go. But they're just doing it at other places. A lot of guys are down in Florida. Some guys are in Arizona. Some guys are in California. So the guys are still getting ready to go in terms of the season. It's just they're doing it elsewhere.
Dr. Velpot, Tiffany wants to know, what advice do you have for parents getting their students ready for fall sports, football in particular, but we play other things too, and our young ladies as well. What would be your best advice to a parent to help guide their kids?
I think a summer training program all around, like working out with lifting weights, is very helpful. That also helps prepare them to try to prevent injuries. A trainer can help sometimes through their schools. Also, there's classes, as in our performance center has classes to help prepare kids for the season. I think that's very important to try to prevent injury going into the season.
Dr. Burton, how do you help prevent kids from getting spine injuries? As a parent, that is a very scary, that's kind of the one go-to. We think of head injuries, spine injuries. Those are things we want to avoid. What advice do you have for parents?
Yeah, one of the things that I see a lot are injuries from overtraining. We take care of a lot of gymnasts here, and also some of our strength athletes that they get into weight training and they really start focusing in their weight training on maxing out rather than focusing on form and lighter weights. And so when I see young athletes that have injured their back, it falls into either one of those two categories. Either overtraining, or they're doing weight type exercises with weight that's probably a little beyond what they ought to be doing, and they're not focusing on the correct form in their lifting mechanics.
Okay, I have a question for you.
All right.
It's from me.
Okay.
Mom.
All right.
Are trampolines bad for the spine for my kid?
They for sure are when you land on your head.
Okay. So it's not feet first. It's they sure are. But which my kid did the other day, and I freaked out.
Yeah.
So.
Yeah, they're pretty dangerous. I think if you look at the American Academy of Pediatrics, they recommend against them. I can tell you, my kids weren't ever allowed on a trampoline. You only have to take care of one kid with a spinal cord injury to know that it's probably not worth it.
Okay, so I'm going to tell my kids that Dr. Doug Burton, doctor's orders, you are not allowed to go on the neighbor's trampoline. End of story, end of question. Okay. Dr. Key, question for you. It's my understanding that Kansas City is one of the 3 cities that is possibly on the table for a location for what's known as the Mlb Combine. I want you to tell people what that is, and that just how much that would expand the footprint of Kansas City as far as, being on the national spotlight for the MLB.
Well, the NFL has had the combine for forever. So MLB last year in North Carolina decided to have their first ever MLB combine. And so with that, it went okay. There was a lot of tweaks that needed to be done. And so probably 5 months ago, I was approached by Major League Baseball about the possibility of having the MLB Combine here in Kansas City. They want it central, and I think that what we have in Kansas City, the infrastructure that we built in terms of sports medicine, in terms of where places are here in the city, we have a new airport. It's in the middle of the country. Bodes very well for us having it here, which would be huge. And, the possibility of having it here on a 3 or 5 year or even a permanent basis And so I'm in the middle now of submitting a proposal to Major League Baseball in terms of having it here. And like I said, the things that we can do here, I know on a game by game basis, in terms of taking care of athletes here and opposing players, a lot of people like to come here because of what we can do here. We can get MRIs in the middle of a game. We can get patients, players' places. We have a very good medical system here that's almost second to none. And so based on that, I think we have a really, really good shot. It's basically Cleveland, us, and Houston who are bidding for these. But I really think we have a very good shot. I told him it doesn't hurt that I'm the president of the Team Physicians Association. I told him I may try to make a power play.
Why does that not surprise any of us? Little name dropper. I like it.
Yeah.
All right. Update us when you know more. Thank you so much for that. Angela wants to know, Dr. Hawkinson, do those kids that are under 15 or maybe 12 to 15, do they need a booster? What do we know about boosters for teens?
Yeah, I believe that the only age is either 15 or above or 16 and above. Still waiting for the data on that. Again, I believe it will probably be safe. Will it be efficacious? I think we have to discuss what that means. Is it efficacious in protecting you against infection or protecting you against hospitalization and severe disease? So I think we are still waiting for the full guidance and recommendations on that. But we know as the way things are moving, again, we know Israel is giving forth doses to people, those older age groups especially. We know we are waiting for any further data on additional dosing for adults. And so just the same with those people, those young children under 15, still waiting for those additional doses and guidance for the recommendations for that.
Dr. Key, Joellen made mention that you forgot to tell us what an MLB Combine is. Could you tell us what that is for those of us who didn't know until yesterday? Unmute. Oh,
Got it. Sorry.
now we got you. That's okay.
So what the combine is basically players come in, they have a series of things that they go through, whether it's throwing, running, hitting. The players go through a physical. It's a little bit different than the NFL combine in the sense that these guys actually go out and play games. So scouts, teams are able to see these guys playing against each other. So it's almost like an all-star showcase, if you will. So that's basically what it entails.
All right. Thanks for that. Dr. Vopot, got to hit on this one more time. It comes up. Back to the vaccinations. Joe wants to know, like, what does strongly recommend really mean when it comes to advising the chief players to be vaccinated, just from a medical perspective? Is that all it's coming from? We're doctors. We say you should get it. Or does it go higher up?
It's also coming from the NFL as well. I think they were leading that very well, that they strongly recommend it, as in they had to have a lot more testing done. They didn't, things were much more kind of difficult with logistics if they didn't get vaccinated. So they didn't have quite the same freedoms that the players who were vaccinated did. So I think it was just recommendations, also restrictions that were placed on the unvaccinated players, and also time lost if they tested positive. It took longer to get back into the game and get cleared again if you were unvaccinated.
Dr. Burton, what other activities should all of us regular folks, not athletes, but the regular people, stay clear of that may cause a spine injury, whether even a small all the way up to a severe?
Well, the number one thing is probably wear your seatbelt. That's...
All right, let's hit him. You tell us what we're supposed to do, and I'm going to tell everybody to go do it.
Wear your seatbelt. Don't fall from heights. I mean, those when we see serious spine injuries, that's how they happen.
Don't jump off my roof. Let me write that down. Stay off the trampoline.
Careful on ladders. We see people fall from ladders with spine injuries all the time, and so. What people say is most accidents occur close to home. It's true, and cleaning out the leaves on your roof, on the gutter. I mean, there's a lot of ways that you can fall, and so that when we see traumatic spine injuries, it's usually a fall of more than 8 to 10 feet.
And something simple that people think, like you said, close to home, because they're at home where they're comfortable, that they can run out and do something and haven't taken the precautions. Are men or women more prone to spine injuries?
Well, men engage in risky behavior more
I
than
knew you were
women
going to go
do,
there.
right? So, there's both groups. But then as we age, women are more prone to osteoporosis than men are, and so they're going to be more prone to fractures associated with thinning of the bones.
Okay. Good info. Good takeaway info today for that, Dr. Burton. Okay, we're going to get to some final thoughts this morning. Great conversation. And Dr. Vopad, I'm going to start with you. What do you want us to know? Just us, like I said, us weekend warriors who go out there and hit it hard or are playing around, and us parents who are sending our kids out on the field. What do you want us to know?
I think for the average person is to exercise throughout the week. Make your routine. That's probably the best thing the closest thing we have to the fountain of youth is to strength train several days a week, as well as to be stretching. And that's why I try to tell all my patients. And then we need to do that so we don't just work out on the weekends, because that's when we have injuries. And if we want to stay healthy and stay active as long as we can, I think that's important. Also for our younger athletes, it's good for them to get into a routine also, so they start that now for the rest of their lives so they can kind of stay healthy. I think that's kind of a big thing in our country that we should be emphasizing more.
Very, very good point. Thank you for that, and thanks for being with us. Dr. Key, I hope you are down in toasty Arizona very, very shortly, but you got to eke it out with the rest of us here. What's your final thought for us?
I think Brian's right in terms of kids working out, especially my baseball kids, because baseball season's coming up now. Honestly, it is getting into a routine and making sure that their arms are good and their legs are good, meaning they need to be stretching, like I said before. They need to be doing strength work and not just doing it the day of. They have to fall into that routine. More is not better. Smarter is better. The kids do need to take rest. I see that a lot in these kids. They're overworked and undertrained. And our studies showed, at least in baseball, that if kids play baseball 8 months or more out of the year, they have a 5-time higher risk of injury than those who play less than 8 months. So there is something to be said. Cross-training, playing other sports is a good thing. And so starting really at about 13 is really when kids in baseball need to start training to play baseball. So I think those are the big takeaways.
Thank you both so much for taking care of our kiddos here in our area. We appreciate you both, and thanks for being with us. Have a great weekend. Dr. Burton, some parting words. What would you like us to know as we head into a weekend?
In terms of spine health, we kind of talked about that. Careful on your ladders, wear your seatbelt. But exercise is key. That's for lifelong health. I think that's the biggest thing. People need to find the exercise that works for them and stick with it. As we age, and I'm certainly in that age group of feeling the aging, we've got to keep moving. And so find something that you like to do and stick with it. That's one of the keys to good health.
Does it hurt when you get out of bed like it does me sometimes?
Every morning.
Every darn morning. When did that happen? Thank you so much. Good to see you today.
Thank you.
Dr. Hawkinson, final thoughts.
Yeah, I'm surprised Dr. Burton didn't throw in a Go Wildcats in there, but just like you, Jessica, my favorite stretch in the morning is a stretch for the coffee. Yes. So I think, but again, I'd like to thank our guests. They are compassionate, excellent surgeons. Hopefully you never have to see them, but if you do, you will be in good hands. So great physicians, great surgeons, wonderful athletic supporters as well. If you can, everybody go out and get some activity this weekend. If you are outside, please be careful. Don't slip on the ice. We know there still is a lot of ice out there, but overall, do it in a safe manner. Yes,
be careful. Stay out of the ER, as we always say. Okay, before we go, here are a couple of sweet gentlemen I had a chance to snap a picture of. They didn't know I was doing it, but I had to. So that's our Morning Medical Update team members. That's Alex Brown and Cliff Irwin. As they were taking the crew home yesterday, we kind of did like a big group Uber and got here safely. But they stopped to help out this driver and her dog, as you can see him sticking out the window there. They were stuck out there in Johnson County. This gal's wheels were spinning, and they jumped out to help. And so we just want to remind everyone, be like Cliff, be like Alex. Practice those small acts of kindness when you can this weekend in the snow, and certainly, anytime. Thanks for being with us today, everyone. And you can check out our show anytime on Facebook and on YouTube, coming up Monday. Throughout our program, we have discussed and introduced you to several COVID long-haul patients. On Monday, you'll meet yet another one who was bedridden and ultimately had to quit her job. This leaves many people wondering why them and not others. Now, a new trial is underway at the University of Kansas Medical Center, hoping to answer that question. And they need your help to do it, how you can participate in the latest trial, and what researchers are looking for. Everyone, have a fantastic Friday and a very safe weekend. We'll see you back here Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.